the first thing that happens when a child is born, and which sometimes scares the parents, is the fact that the child gets jaundice. Now, the first thing that a homeopath does, whenever there's any symptom that is told to them or whenever they see any condition, is think about the remedies. And they want to try and see which remedy fits this particular person. So if there's a person who has, maybe not related to pediatrics, but a person has come with a dry cough, with chest pain, which is stitching, and every time they move, they get pain, our mind goes straight to bryonia. But have we actually thought what is wrong with the person? Is there a pneumonia which has gone into a pleural reaction? Or is it an intercostal neuralgia? Or is it some injury to the chest wall? Just giving bryonia is not enough. You need to know what is going on before you can give the right remedy. Similarly, when you're dealing with children and infants or neonates, they can't speak. They will not be able to tell you what's going on. You have to look at the child and you have to get some information from the parents or from the attending nurse and observe and then treat. You also need to have a good diagnosis. So what happens? Okay, let's start with the first thing that can happen, and that is the child is born and the limbs are blue. Now, what is the problem? There could be two possible things. One is it's a natural physiological condition called acrocyanosis. So at that time, don't start treating the child with homeopathic remedies. So in acrocyanosis, because the child was in a warm, comfortable environment around 37 degrees centigrade or 98.6 degrees Fahrenheit for 9 months, and or maybe slightly more than that because it's within the body, and all of a sudden exposed to the cold, chilling air of the air conditioning in the operation room or in the labor ward, or when the child is delivered, and that causes the extremities to turn blue. So that's just a normal reaction. The rest of the baby is pink. The breathing is normal. So don't stress yourself and don't get worried because the parents are stressed. All you need to do is just warm the baby up and the acrocyanosis disappears. So that's a normal, natural, physiological process. At this point of time, you're not supposed to give the child antim-tart or lorocerosis or any of the other remedies. However, if you do get a child with asphyxia neonatorum, then that's the time these two remedies are going to be useful. So antim-tart and lorocerosis. These are two remedies that have been mentioned in books. We have seen them being used in our practice. In fact, I have given quite a few of the neonates antim-tart or lorocerosis because of the condition that they had, the asphyxia neonatorum. Now, antim-tart, you all know the symptoms of antim-tart. One of the things that I like to discuss when I'm teaching materia medica or when we do therapeutics is to understand the remedy or try to understand the pathophysiology of the remedy. So antim-tart, you all know, is a drug for the death rattle. So that when the child or the person is coughing, or let me just shut down my Outlook. Okay. So when the child is coughing, you can hear a lot of loose rattling sounds in the chest. The child turns blue. In case of antim-tart, you have a pale face and they turn blue. There's a death rattle. The child becomes very irritable, cranky. The child becomes very drowsy. This can also be seen in the older people, in old people with respiratory failures, where they become cranky or irritable, they become drowsy, and usually you find the symptoms are worse early in the morning. Now, this drowsy state, this crankiness, the irritability, the peevishness that you see in antim-tart, especially when they have the death rattle, is because they are going into hypercapnia. What is hypercapnia? Hypercapnia is an increase concentration of carbon dioxide in the blood. Because of the fact that the exchange of gases has been affected, this child is not able to get rid of the carbon dioxide that is circulating in the blood, and that leads to increasing levels of carbon dioxide in the blood. When they cross the blood brain barrier, that's the time they become irritable, they become drowsy, and you find this peevishness, the crankiness. They might turn bluish, or they get cyanosed. So the symptoms of antimptard are mainly as a result of hypercapnia, and that is a very important indication for this remedy. So any child that comes to your clinic, or any person who comes to your clinic with a cough and you hear some loose sounds, antimptard is not the remedy, because it's a remedy for the last stages when the person has got the death rattle. So obviously, if he's walked to your clinic or he's walked to your office, he's not antimptard. You might need to think of some other remedies. Laurocerasus is another remedy for asphyxia neonatal. It's also very good for older people and adults when they have respiratory symptoms. Usually, when you have a person who needs laurocerasus, especially if it's an older person, and when they have a heart problem, they are the ones who are relieved when they lie down. So the cardiac symptoms are better on lying down, which is a very peculiar state. Most people are worse lying down. So these two remedies are what you should keep in mind. If an older child, I'm going to keep digressing. I'm not going to just stick to one remedy. I'm going to do a lot of comparative materia medica. I'm going to do a lot of differentiation of remedies while I'm talking. So even though I might be on one particular topic, you might find me flying all over the place. But there's going to be a common thread which brings us back. You can just pull the thread and go back to where we were. In an older child, you might find that antimptard is very similar in its symptoms to ipecac. Ipecac and antimptard have both got cough with a lot of rattling. Both have got a lot of vomiting, and both of them will be in acute respiratory distress. Now, what is the sphere of action of both these remedies? Or what is the physiological action? Both of these remedies, they have an action on what in the olden days was called the pneumogastric nerve. That's also nowadays, of course, you all know, it's called the vagus nerve. And as the name suggests, pneumo and gastric. So this is a nerve that innervates the stomach as well as the lungs, to just simplify the whole thing. Now, both the remedies, ipecac as well as antimptard, have an action on the pneumogastric nerve. That's why they have somewhat similar symptoms, but there is a difference between the two. You will find that ipecac is always indicated first, and later, as the condition worsens, antimptard comes into the picture. Ipecac is usually seen when a person comes with what in the olden days was called capillary bronchitis, or a better term would be bronchiolitis, while antimptard is going to be used for chronic bronchitis or COPD and patients who go into acute respiratory failure. So both the remedies have the same nerve which is affected, the pneumogastric nerve or the vagus nerve. But the difference is that in case of ipecac, it causes an irritation of the nerve. So the nerve is in a state of extreme irritation. So even though they don't have a stomach issue, because the stomach is being irritated, the person has a lot of nausea. And you find nausea is a very important indication for ipecac. They have a lot of nausea. They keep gagging, retching, but nothing really comes out because the stomach is not, the organ is not at fault. It is the nerve supply to the organ that irritates the stomach. Same with the lungs. It's the irritation of the lungs, and that leads to a lot of cough, and it leads to a lot of wheezing, a lot of breathlessness. So you find that After vomiting, the patient does not feel better because that irritation persists. The nerve is still irritating the stomach, and the child will keep retching, keep gagging, and will vomit, but it does not relieve. Now, as this condition progresses, the right remedy somehow was not given, or the child was under the treatment of an allopath or a pediatrician who doesn't know homeopathy. What happens is that he will slip into a state where the irritation of the pneumogastric nerve is followed by a depression of the pneumogastric nerve. So the pneumogastric nerve now just gives up, or the vagus just gives up, and the child will still have some vomiting, but now, because of the fact that the lungs are not functioning as well, all the secretions that the person has start collecting in the lungs. And that leads to the loose, moist cough and the rattling sound that you hear. And as the person's secretions keep collecting, he's actually drowning in his own secretions. His lungs are getting filled up with the secretions, and that reduces the possibility of an exchange of gases that leads to low oxygen or hypoxia and high carbon dioxide in the blood. And that's why they turn blue and they become irritable, they become drowsy, they become very sleepy, and as you know, they become very peevish. So if you're not able to get the drug at the right time, you might find that the patient's condition worsens, and from an irritation of the pneumogastric or the vagus nerve in ipecac, you go into a state where there is a depression of the vagus nerve or the pneumogastric nerve in antennat. And that is even worse because now this condition has progressed to a point where it becomes an acute emergency, and you have to reverse this condition and bring the patient back to a state of health. So understanding the remedy is also very important, not just knowing the symptoms, because two remedies can have similar symptoms, they can have a similar action on the organs, but the action could be either an irritation or an inflammation, or it could be a depression or a destruction. And that can make a lot of difference in the way you treat this child or this person in general.